Good afternoon, everybody. I'm Matt Harrington with the Southwestern Vermont Chamber of Commerce. Thank you for joining us again for a special telecast brought to you by CAT TV. We want to thank CAT TV for allowing us to be in their studios once again during the COVID crisis. And joining me again today from Southwestern Vermont Medical Center, CEO Tom D. and Chief Medical Officer Dr. Trey Dobson. I want to thank both of you gentlemen for being here again. It seems like we're emerging out of this crisis. And we're taking baby steps, and the governor's taking baby steps to kind of move Vermont forward. But I thought we'd start by just asking, Tom, from your perspective, how are we doing on the whole crisis and the whole state as a whole? How are we doing as a country? And then perhaps more in your line, how is Southwestern Vermont Medical Center doing?
Well, thank you, Matt, and thank you and the Chamber and, of course, CAT TV for putting these shows on. These are terrific opportunities to talk about, what we've been dealing with at the medical center. I had to say SVHC is really a resilient organization. I looked back, 60 days ago, we were talking and we were meeting and we were thinking about what we were faced with, and back then we were thinking about we could have up to 100 COVID patients in the hospital. Yeah. And we were concerned, certainly, we still are, about the health and welfare of our employees. It's always our number one concern. And things such as our PPE inventory, do we have enough? Because we have read the stories about what's happening in New York City and other major areas. But I think it's amazing how well the organization has fared and been able to overcome some adversity. But we're not letting our guard down. I think that's, Trey has been a terrific taskmaster as our incident commander, and we went through the planning and the preparation and the readiness phase, and we are getting into the ramp-up phase, which is exciting. But we're also dealing with the impact of the COVID-19 pandemic, and financially, since I deal with that a lot in my day, that certainly has had a financial impact on the organization as well as other businesses in the region. Thank goodness, we're starting to receive federal stimulus dollars from the CARES Act, which is going to help us. It will not cover all of our impact, but it's going to help us here. And Governor Scott just came out recently with his statements of support for the healthcare system, not just hospitals, but doctors and the EMS and nursing homes and the doctor offices, and that was a great show of support. And everyone's really stepping up, continues to step up. And just one story, and you're not going to see this very often, where the members of the Dartmouth-Hitchcock-Putnam Medical Group, which is a big group we have, voluntarily all took, a majority of them took pay reductions to help the health system and to help do their part in terms of this crisis. And they've been doing their part. They've been caring for everyone, and they've been doing a wonderful job. But it just shows how people are pulling together to provide support. And as we now are getting ready to do the ramp-up phase, in the last couple of weeks we're seeing an increase now in our inpatient business and our outpatient business. We're hoping that's going to allow us to get back on solid footing. Again, this has been a very challenging time for our health system. We've had, we're 1,500 people strong at SVHC. The financial crisis has had us to do furloughs. That's been difficult, but we're starting to see people come back. And just this week alone, we were able to bring back close to 20 employees. And as we get busier and busier, we hope to bring back more people. So that's all good news. And now we're starting to do our planning for our major initiatives that we had to put on hold. I think people know we have a major emergency room project we're looking at doing, $25 million. And I think this pandemic has shown the critical nature of our emergency room, how we need to be a state-of-the-art facility. So we're starting to plan for that. We're working with the state health department on those questions, Green Mountain Care Board. We're now getting back to the Putnam Downtown project again. And that's something that's close and dear to our heart, to get that project up and going, and that's moving ahead. And also, littler things at the health system. But this, I think, this crisis highlighted the key aspect is, our daycare center called the Learning Tree. We have 40 to 42 little kids in that daycare center, and we made a decision to expand it. We're going to expand it by 20 spots, and again, and that's helped to fill the need that a lot of the areas have, since some of the daycares have shut down. So many things are going on. We have our team of leaders who meets on a regular basis, led by Dr. Dobson. We're getting geared up. We're seeing the volume increase, which is great to see. We're seeing people coming back to the health system, but one more time to say to everyone, we're open, we're ready and we're safe for care. And we're hoping that people will come and utilize our facilities, and as they come, they'll see the many things that Trey and the team are working on to make sure people feel good about coming and getting their health care.
Dr. Dobson, let's go to you. Just an update in terms of how many cases in Bennington, if any cases, and how the staff is doing, and where you kind of envision the summer going for SVMC.
Sure. Well, so the number of cases in Bennington and in the state, as you've read and see, is extremely low. I didn't look this morning, but looking yesterday, I believe there was one patient in the entire state that was hospitalized with known COVID-19. So the numbers are very low. As we move into the summer, the numbers will increase, and we know that because everyone has done an excellent job of isolating, but now as they start interacting, there will be some transmission of the virus. The great news, I didn't say good news, but the great news is that transmission is still going to be low because people are adhering to the things that we've learned over the past 4 months are very effective at decreasing and limiting the rate of transmission. Wearing the face masks, doing the social distancing, washing the hands, and then as soon as we do identify someone with a disease, taking care of them but isolating them so that they can just return in 14 days and be right back in the community but not spread the disease. They're so incredibly effective. Communities that will adhere to that will have very few outbreaks and be able to, frankly, return the two things that are so important: health to the community and then the economic well-being. Regions that aren't able to do that, that don't have a culture that supports that, it's going to be tough for them. They're going to have lots of outbreaks, and people are going to really have fear and not go out in the community like they need to be. So we're pretty excited that we're through the hump, but there will be transmission of the virus, and we're ready to take care of it.
Talk to me about testing. Testing's still going on, more people getting tested. Sounds like 1,000 per day in Vermont, which sounds terrific. And I guess for those watching, how do we go get tested, and where can we get tested, and does it cost money, and how fast are the results on that test?
Sure. So the state has really put forth a strong effort. It was difficult in the beginning. They were limited by the cost of the materials, worry about the PPE that's required, but much of that concern has dissipated. So the testing, you can go right on the website for the Vermont Department of Health, and you can sign up. It's actually a pretty slick website. You can just sign up for your slot and then go get your test.
Oh.
The test is the sensitivity and the specificity, which is the accuracy of the test, is much improved for asymptomatic individuals. And it is a good idea to be tested. In fact, many businesses and school systems will need to be testing regularly their employees, so that quickly we can identify people who have the disease, again, pull them out, give them the treatment they need. Often they're asymptomatic to begin with, so we isolate them and get them back in. At SVMC, we, like all the other hospital systems, have opened up and increased our ability to test for symptomatic patients. At some point, we'll be also offering testing for asymptomatic patients, and I would say that's within a couple of weeks.
Talk to me a little bit about, this question has come up before when we've done this. What if I've already had it? What if I've gotten over it? Does a test show that, or even the ability to have antibodies in the body? Certainly,
Matt, and we were talking about this a little bit before we went on live here, that we've learned a significant amount about the virus, more about this virus than any virus in 3 or 4 month time frame. And a lot of that has to do with transmission and the effects on the body. But what we still don't know, and it's going to take a lot of time is to figure out how long you're immune after you've gotten the virus. It is likely that it is a few years. And I say that based on studies with other coronaviruses. But we don't know that. It could be as little as a few months, and it could be as long as decades. So right now, if you got an antibody test and it showed that you had been exposed, you're probably okay for a few months, and that is as much as we can say. Of course, we hope it's a few years at least.
Sure. And we were talking right before we hopped on, I think the end-all be-all would be a vaccine. So just any update since we've last went live 2 weeks ago, how's that process going, and do we kind of need to kind of hunker down and wait for it, and what's that projection timeline look like?
Well, I don't think we can hunker down and wait for it like we maybe were hoping a few months ago. And you got to remember that back then we were really nervous about this huge volume of patients, which many places did experience. We fortunately did not. So we can't wait for a vaccine. We have to return to doing the things that are emotionally beneficial, economically beneficial, but we have to adhere to the hand washing, the mask wearing, and the social distancing. As far as a vaccine, it is likely we will have a vaccine at some point, and it's likely that it'll be fairly effective, but it'll be more of a regular thing that you have to do, get the vaccine. There's probably going to be people who refuse the vaccine, so they have to continue to do some of the mitigation that's required. But as far as updates on the vaccine, it's not going to be until the fall until we really have some updates on that.
Great. I want to shift gears over to you, Tom. We've talked on these telecasts before about the community support, and really, what makes Southwestern Vermont Medical Center and really the region special, among other things, is the hospital. What makes that hospital special is the community. We talked a little bit about the staffing that goes into that hospital, but you've also started a COVID relief fund, and you've also worked with downtown businesses for meal train. So just talk to us a little bit. How's that going? How's the relief fund? How do people donate if they want to continue to donate?
It's really been remarkable, Matt, the outpouring. I was just looking the other day. We've had 175 organizations and individuals donating PPE to the hospital, in a very short period of time. I mean, it's unbelievable, with the outreach, and it continues to come in. And so we thank people, and we appreciate that, and please don't hesitate to continue. And the COVID Relief Fund, only been in existence, I think it's now like 7 weeks, and just this week we eclipsed the $500,000 mark in terms of people supporting us for really the costs that we've incurred for these unforeseen expenses for our relief efforts. And that's, again, it's been remarkable how generous everyone has been. The meal train, people are working through our local restaurants, so it really is a win-win where people are donating food to our work staff, and they're working through the local restaurants who deliver the food to us. And we had two of our board members who are actually former nurses recently celebrated Nursing Week, and they ordered through the local restaurants food for all of our staff, all our nursing staffs, and all 3 shifts.
Wow!
It was remarkable. And so the outpouring of supports and kind words. I'm getting letters all the time talking about how people feel. So, and this has been a silver lining in this whole event, is how I think it's pulled the community together in many ways. And by the way, it's just not the hospital. It's all the providers.
Absolutely.
I mean, we have this region has a wealth of tremendous professionals who are going out of their way, from local physicians to our EMS to our nursing homes to again, many providers in different specialties. So it's been a great story, and I think it's actually one of the best stories in the state of Vermont. I mean, I get calls from other hospitals all the time asking us about the relief fund and how we're doing it, and other initiatives. So we're very grateful for everyone, how they reached out to us.
Great. Maybe for both of you, last week the governor announced resuming inpatient services. So how's that going, and what are some of the inpatient services that you've seen kind of come back online in the hospital?
Well, just to clarify, we've been doing inpatient service all along.
I was going to say,
a lot of people think we have not been. We have been doing it, but it's certainly the numbers have been down. But we were glad to hear that we can start to do do elective and non-urgent work, and actually we're seeing a ramp up in business, and it's for instance, our surgical services, which has been pretty quiet in the last 10 days, it's almost getting to the normal level. So again, we're doing things in a safe way, and we're being A lot of efforts are going on to do that, but we're happy to see that. And even the emergency room was very quiet and was concerning us how quiet it was. I think over the last couple of days, it's almost been up to close to normal in terms of
That's right.
the business. So it's it's been positive.
Yeah, Matt, the hospital is actually the safest place you can be in a public area right now in relation to COVID-19. We've put in place every recommendation, not requirement, recommendation by the CDC, because we're able to do that. Now, some hospitals are just simply not able to do that because they don't have the equipment or certain staffing things, but they certainly follow regulations. But we're able to put in place anything the CDC recommends, and we often do it before the CDC makes it an official recommendation. So I feel very confident in the staff. We know that it is an extremely safe place to be. What we're concerned about, and we mentioned this a little bit last time, since we've talked, data has come out to show that people are not seeking medical care, and it's actually increasing significant illness and even death. There have been some places that have shown heart attack rates of 1.5 times, so nearly twice as many people having their heart attack outside the hospital system and actually dying because they're too scared to come to the hospital. And boy, we feel for those people. Our mission is to take care of those people, and we just want them to understand that it's actually very safe and very appropriate for them to come in.
Matt, every day, Trey and Ray Smith, our Director of Communications, puts together an update for our health system. New guidelines, new recommendations, information from the governor's office. And I think we probably have the best communication system in the state in terms of what's going on, in terms of how we're communicating to our workforce.
You're about to make Ray a doctor, I think.
Yeah.
I mean, at the end of this
it's been
crash course.
It's really it's been terrific, and that's how I think we keep everyone on the same page. We keep the morale up because people know what's going on. We try to reduce surprises, and that's, I think, the numbers that we have are low, but they don't happen by accident. We get some breaks, but it's a lot of preparation, a lot of hard work is making this happen.
As much as we're celebrating now, I'm sure there's a big celebration when we get out of this and we actually take a kind of a post-mortem and we look at what really led us, down that path of success. I think that's going to be a great day when we get there.
Well, there's a great story to be told, and sometimes I think there's some publications that have to come out of this.
Yeah. Yep. If you're just joining us, we want to thank Cat TV for broadcasting live this special telecast with Southwestern Vermont Medical Center's Tom D. and Dr. Trey Dobson. If you have questions for them, we're going to go for the next 15 minutes, but if you have some questions, we're monitoring live on Facebook, so just write those questions in. We've done this before, and I will monitor, and the studio will monitor, and we will try and get to those questions. It's been very, very helpful to hear from our audience. A couple more questions that I have, and then we'll look to Facebook. We've talked about a lot about the innovation that's been required of hospitals around the country, but specifically the Dartmouth, Hitchcock, and you guys up on the Hill. One of those being a virtual waiting room. Mm-hmm. So talk to us, Dr. Dobson, maybe you first, and Tom, kind of the idea behind that. But what is a virtual waiting room, and how does it work?
So, before COVID-19, if you went and saw your doctor or you're going to get an x-ray, you may be in a cramped space, waiting right there before you get called in. And what we've done is we've set up something very similar to a restaurant, where you log in when you approach the hospital, and then you can wait in your car. Now, you don't have to, but for those individuals that can, we encourage them to wait in the car, and then they get a little, text message that has them, notifies them they can come in, and they go right up. And what that does, that's just one of the many new safety mechanisms that's put in place. And you do the social distancing. And I'll actually say it's pretty comfortable waiting in your car, chatting with your significant other before you go up to see the doctor.
And even with restaurants too.
That's right.
I mean, there's been some great innovation there that we've talked last time, that I think as new Vermonters start to move up here from urban settings, hopefully we've really ramped up our businesses to compete in the 21st century, which means online ordering, delivery, all those types of things. So I know there's been plenty of people that have been excited about ordering from Ramonto's and sitting in their car and having a pizza delivered.
Yeah.
It's kind of nice.
Just did the other night. And of course, we have to improvise because we're not a huge institution with lots of space. So certain services, such as our Putnam Cafe, it's remaining closed because we want to be able to utilize that as a overflow for waiting space. So we're looking at those type of things that will have some impact, negative in terms of services we had in the past, and we'll figure those problems out. But I think the innovation and the ideas have been terrific.
Yeah.
Continuing on that theme of innovation and the partnership with Dartmouth-Hitchcock, a lot going on with telemedicine. Talk to us about some of the success stories of that during the last 75 days, and then, I'm sure that's here to stay. So what does that look like for the future of the hospital?
Yeah, well, it's actually been incredibly successful. With the pandemic came the need to think outside the box. We've always known about telemedicine, so there were just barriers, and those barriers went away. And we were doing, at one point during the biggest part of the crisis, we were doing close to 80% of our primary care visits through telemedicine. And we think it'll remain, somewhere around the 25% of the appointments can be done through telemedicine. Some more, some less, depends on what the specialty is and the need, but all of the specialties are doing telemedicine. And in fact, it's pretty seamless. If you followed a doctor throughout the day, or a nurse practitioner, or a physician assistant, and you watched them, they would be seeing patients in person, and then they move over to the computer and they see them on telemedicine. And so it's been a very positive experience.
And we've been ahead of the curve, Matt, on this. I mean, I think in terms of community hospitals, I would say in probably northern New England, we may be the most wired hospital for telemed. I mean, we've had before COVID, we've had at least 15 different applications and services throughout our health system. So we made a major investment. We spend about $1 million a year on telemed services. So we're far ahead than most organizations in terms of that, and this is going to be a springboard to do more and more telemed.
Yep.
And I think the public seems to like it too.
That's right.
So as the weather heats up, we were talking about that before the show too, kind of uncanny weather this past week. People starting to get excited about the success of Vermont's kind of rate of decline of COVID. Getting antsy. It's nice weather out. People are starting to go out. Talk to us, Dr. Dobson, about, let's start with the do's and don'ts while you're outside, maybe recreating or any of that stuff. What can people do? What shouldn't people do?
Well, they should. So the do's, they should get outside, and they actually should interact socially, because it's detrimental to not be interacting socially. You just have to do it in a way that maintains those things we talked about. When you go into a public space, you wash your hands, or you use the sanitizer. And when you go out of the public space, you wash your hands or you sanitize. You keep the social distancing of 6 feet. You wear a mask. And you try to do as much as you can outdoors. And there's a real reason for that. And that is just a little bit of air movement removes the aerosolized viral particles. It disperses them very quickly. So the high-risk areas that we've learned about are poorly ventilated spaces where you're close together and not wearing masks. And incidentally, we know that because that's the people that are getting affected, where you have lots of people infected. I think people are probably aware in some neighboring states over the past couple of weeks, as people have gotten out, they've come together in tight spaces to have parties, and next thing you know, 30 or 40 people coming down with the virus. But those same people would have maintained some distance and maybe tried to do some of the activity outside. They would have had the benefit of interacting, of socializing, but it would have been very limited spread of the virus, if any.
Yeah. Talk to us about the role, or the lack of the role, that heat and weather have on the COVID virus. I think oftentimes when we think of flu, we think of winter, maybe early spring. Now it feels like it's summer weather. Does that have any impact on the virus, or no? We've got this, and it's here to stay.
So the answer, Matt, is it probably does. The heat and the humidity probably decreases transmission. Unfortunately, not as much as it does with other viruses like influenza. And the reason is this virus just happens to hang on to very fine water particles stronger. In fact, if you've seen pictures of it, many people have, it's called corona because it looks like a crown. It has spiky proteins that hang off the surface, and those actually adhere to that surface of a water molecule easier. But it is likely that it is inhibited some, but just not to the degree that we wish it was.
Sure. And with that, There's been talk about resurgence, possibly late summer, early fall. Any more data around that, or anything we need to be aware of?
We don't have any data on that. We have a lot of people that predicted that. They predicted that there will be a resurgence when the flu season comes, which is the fall. Now, when they predict that, that's before putting in place all the mitigation of the social distancing. The reason the flu, one of the many reasons the flu and other viruses peak, is people start congregating because it's cold outside, right? And they start being in poorly ventilated areas. Now we know not to do that. It doesn't mean we can stand outside in the cold, but it does mean that we can spread ourselves out, ventilate our areas a little bit better. You'll see a lot of offices starting to do that. And there may be some resurgence of the virus as people do that, but fortunately, everyone feels very confident, or at least most feel very confident, that resurgence won't be the fear that we experienced months ago.
It must be fascinating, because some of these are all things you learn in kindergarten, right? Stay apart, wash your hands, don't cough on people, and yet it must be fascinating as a doctor to see the amazing impact that a couple different social behaviors really do have on a mass amount of people.
That's right.
That's just fascinating.
We've been amazed by the hand washing. That was always kind of a little bit of something you had to keep reaffirming. The hand washing now has become part. It's embedded in everything we do.
Yeah.
And it's so that plays a major role here.
Yeah, not only with COVID-19, but other viruses now.
Sure. Sure. Did you see a reduction in other viruses, basic flu, what you basically see come through because of some of that social distancing? I think we had talked a little bit about that before.
Yeah. It coincided with the typical decrease in flu rates anyway, so I can't say that it was due to hand washing, but I'm certain it didn't hurt it.
Yeah, right. Recently, the Bennington Select Board, just this past Monday, and the Wilmington Select Board before that, voted to wearing cloth face covers indoors at stores and around groups of people. What is the significance of this directive? And Tom, I know you even wrote a personal letter in support of it. So talk to us a little bit.
Actually, it was Trey.
Oh, was it Dr. Dobson?
Who wrote that letter?
Well, lest people forget, we're actually in an international crisis called a pandemic that calls for extreme measures, and temporary ones at that. The purpose of wearing a mask is to protect others. So it's really a no-brainer, Matt. If we know that it is effective at decreasing the spread and saving lives, then we have to do it. If we have to put a town ordinance in, then so be it. It's an emergency situation. When the emergency goes away, so do the requirements.
And at the hospital, it is a requirement. So
Yeah.
anyone who comes into the hospital have to wear a mask. If they don't have them, we encourage them to bring their own mask. If they don't, we'll supply one. And our entire workforce has adopted that and embraced it, and we'll be doing that for a while.
We have a couple questions coming through on the masks. It's been regulated to indoors and businesses. What if I'm walking down the street? Should I be wearing a mask? I walked here from Cat TV. I wore a mask just because I didn't want to be told I wasn't wearing a mask. So thoughts around that?
So, people certainly can wear the mask. It's not likely doing anything, Matt. It's not protecting themselves, and it's really not protecting others. Now, if you were walking down a very busy street in an urban area and you were constantly coming up close to people, then that would be appropriate. For most of these rural areas, I would actually say give yourself a break during those times. Take the mask off, and then use it when you're indoors in close proximity. So when we're at the hospital, we wear them 100% of the time. In other places, if you're maintaining social distance and you're not interacting much, you can take the mask off. But once you get within that 6 feet, and also once you're in a room for a prolonged period of time, you should be wearing the mask, because it's been shown to be somewhat effective, not 100% by any means, but somewhat effective in preventing transmission. So you could be asymptomatic, but then you're giving it to someone who could become very ill.
In trade, the mask is primarily to protect others around you.
Protect others around you.
I want to remind people we've got about 5 minutes left with Dr. Dobson and Tom D., CEO of Southwestern Vermont Medical Center. If you have questions, we've got 1 or 2 left on Facebook. Make sure you get them in there. I'm sure as news comes up, we will be back in the studio with both of these great people of our community. But a couple final questions. This again revolving around masks. I want to read this one from Facebook to probably to her point about wearing masks in public restrooms as well. And so this is from Julie. Can you address the masks should be worn when going into a restaurant restroom so as not to spread the disease, as servers are wearing masks but the clientele is not. But then if they have to go inside a building to use the restrooms, they are bringing with them unintentionally without having symptoms, something that could be contaminated with the staff of the restaurant. So I think, kind of two questions there. As you're going into any public restroom, I think the idea of wearing masks, and then I think as maybe people are kind of zooming into a restaurant that now may be open, that they need to be wearing masks.
Sure.
So just speak to that, Trey. We've kind of hovered around that. We've talked a little bit about it, but just to reinforce that, I think would be good.
Right. So when we talk about doing something like wearing a mask, what we're saying is you should wear the mask when it's reasonable, appropriate, and possible. So for example, when we're having meetings at the hospital, sometimes the speaker, because of the difficulty in speaking through the mask and being heard like we're doing now, takes off the mask while everyone else is wearing their masks, but we maintain a good distance. If you're going into a business and there's other people there, it's your responsibility to wear the mask, whether you're going in for just a minute to go to the restroom or you're going in to to a retail store or a restaurant or whatever. Now you obviously can't wear the mask when you're eating, so you take the mask off. The waiters and waitresses are wearing the mask, the others are wearing the mask, and then when it's reasonable, you put it back on.
Good. Wrapping up, we talked a little bit about summer coming, heat wave this week. Some travel tips. We still have we're in a state of emergency in Vermont. I know from the Chamber's perspective, in accordance with the governor, we're not really inviting New York and Connecticut and New Jersey. Mm-hmm. I know we're going to be unveiling a marketing campaign with Vermont Tourism to be a little bit more, if you're a Vermonter, travel in other parts of Vermont and really start to support the local ecosystems and economic ecosystems in other towns, but not necessarily really inviting a whole lot of out of staters for quite some time. So, as we're looking to travel, Bennington to Burlington, it's summer out, we go to the lake. Talk to us a little bit about some safety tips for us.
Right, so there's a reason why borders are in place during epidemics and pandemics, and that is because if people don't cross borders, the disease doesn't cross the border. I know that sounds so basic, but it's true. But some of us have to travel for certain reasons, and that's okay. You just consider it each time. Do I really need to travel? And if I do, how do I avoid interacting and avoid high-risk areas? And so it goes back again, Matt. It goes back to the social distancing, the wearing the mask, the washing the hands, and traveling within Vermont, getting outdoors. Those are important things. People should be taking vacation. It's been a long 3 months, and people need that. And so I wouldn't want to discourage it, and the state doesn't want to discourage that as well. What they don't want is Vermonters traveling to hotspot, high COVID areas, not doing social distancing, and then bringing it back to the state.
And there are so many great things to do locally here too.
Right.
So the more, if it's ever a time to stay local,
staycation.
This is the time to do it.
Right. Megan asks on Facebook, do the doctors consider the CDC's recommendations about how in-person school should proceed to be prescriptive or a suggestion? So I think that kind of revolves around, are we going to be getting back to school after Labor Day?
Sure. So being prescriptive or, as far as what we believe, so we have actually been looking really hard at the guidelines. There's been guidelines coming out from educational societies, and we're working with many school systems, actually from pretty far distances, and they all have a similar theme, and that is we got to get the kids back into the school, but not in the same way it was before, not during this pandemic. So continuing to offer some of the distance learning while mixing in the emotional and social interaction that has to occur. And I will say that what I imagine will happen in this fall is as testing becomes more ubiquitous, cheaper, easier to do, we'll see frequent testing of students. Again, for the reason, if there's a positive, pull that student out, give them the support they need, make sure they're healthy, and then get them back in rather than transmitting it to others.
And you may have saw in the newspaper that Bennington College is doing a major gear up for the students coming back on campus, and they're actually working with the health system in terms of preparation for that, especially on doing testing.
Great. Well, in closing, why don't we remind people, Tom, where they can go to support SVMC, both the COVID Relief Fund, the meal train, or just to get general information about, I know you guys are doing just an amazing communication job. Where can they go?
Our website, svhchealthcare.com. All the information is there about the COVID relief, about all our steps we're doing on our COVID planning, the meal train, so everything's at that website.
Great. Any final closing thoughts before we close down this telecast and get ready for a next one?
Well, we're continuing to gear up. I'm hoping people will understand when they come to the hospital that we're not just creating regulations for the sake of regulations. We're trying to protect people, keep people safe. And so please understand that as you come to the front desk, we'll be asking you to make sure you have your mask, and we'll be asking questions about their health. So that's just us not being intrusive. We're just trying to be safe.
Great.
And just a shout out real quick to the staff, the doctors and nurses, and the non-clinical. You know, even though we've gotten through this big hump, they still every day have been and will be living all of these regulations. You know, fortunately, they have a great attitude, and it's become part of life. But they're still doing it every day.
Yeah. And also one more shout out, really, for the Vermont Air National Guard, who came last week and did the flyover, which was terrific.
That was great.
And they were supported by the police departments, the brigade, the police cars, and they were there as always to support us.
There's never a shortage for hope and optimism, so the more that we can provide it, especially for your staff and your crew working so hard, I know we're happy to. On behalf of the Chamber of Commerce as well as CAT TV and their staff, we want to thank them for having us here today, thank their staff, and thank all the work that my staff has been doing in the background too with the Chamber of Commerce. We hope everybody has a great rest of the week, and make sure, as Dr. Dobson said, to get out this weekend and enjoy some of this fresh Vermont air. Thank you, everybody.